Rami, or Professor, I should say. Professor Moonesinghe.
Thank you.
Thank you very much for joining me this afternoon.
Such a pleasure.
Have you been to Darwin before?
I have. I came to Australia to do my elective at the end of medical school.
Really?
And I worked at the Royal North Shore in Sydney for a few weeks, and then I travelled around Australia and New Zealand, and I came up to Darwin and saw the sites back then.
Okay.
But it's changed a lot in 25 years or so.
Yeah, I bet. I talk about Darwin in my talk tomorrow, so there might be some things that you might remember from 25 years ago. So you're now based in London?
I am.
When did you arrive?
So I was born and bred in London, in fact.
Okay.
And I went to medical school. I've been quite boring, actually. I've always been associated with UCL. I went to university there, then worked around London and a few other places, and then I finally ended up as a consultant at University College Hospitals and a professor at UCL.
I see, right. Wow. So you're born and bred, stayed in there. Lovely.
Yeah.
Now you are a professor and your main interest is peri-op medicine.
It is.
I know you're giving a few talks here on peri-op.
I am.
What do you think are some of the key messages you'd like to impart on us?
Thanks, Suzi. So I think there's a few things here. So I think the first thing is for us to, as a profession, kind of zoom out a little bit. Like clearly, on the day-to-day when we're giving anaesthetics or we're individually reviewing patients, we focus in on the detail, and that's part of our job. We've got to be great at the detail. And we've got to be meticulous and all of those things. And of course, we've got to do that. But more generally as a profession, we've got to zoom out a little bit and look at the bigger picture.
Okay.
We've got to look at the whole patient pathway.
Yeah.
We've got to think about what we can do for the patients, not just during surgery, but before and after.
Yeah.
And I think one of the points I'm going to make in particular in my future directions, like chat later, is this is not just about the patients. This is actually about our survival as a specialty as well.
Yeah, I've heard this concept.
Because technology is advancing.
Yeah.
We've got rapid technological innovation across all of medicine, but it's really going to come to anaesthesia. It's already there.
Yeah.
And so we've got to kind of think about, well, what's our role in the patient care going to be in 20 years' time?
What do we add as people?
Exactly.
Because what can robots not do?
Precisely.
Do you think we will be replaced by robots one day?
Maybe not robots, but I think so much of what we do already has been replaced by machine intelligence. So let's think about, you look at the way that we administered anaesthetics back in the 1800s when we first developed anaesthesia. You had drops of ether going onto a cloth on the patient's face and all that. Now...
And careful clinical observation.
Right.
Like they didn't have alarms, they didn't have monitoring, it was all clinical.
Precisely.
Yeah.
And now we've got machines that do all the monitoring for us. We've got machines that will do basically closed loop anaesthetic administration and monitoring and so on.
Yeah.
We don't just sort of tweak the volatile administration dose, we tweak what we want at the end tidal for the patient. All of that is advanced already just in the last 20, 30, 40 years.
True.
So you push that one through, you see, then ultimately what we do is very algorithmic.
Yes.
And so you remove some of the unwarranted variation by focusing in on the algorithms.
Yeah.
So I think what we will end up being as anaesthetists is much more about the holistic care of the patient.
Yeah.
Much more about making sure we have the right patient having the right surgery for them at the right time.
Yeah.
And helping the patient to prepare and recover from the surgery as well as looking after them during it.
Yeah, and I'm seeing a bigger focus coming through on patient-led decision-making.
Absolutely.
All of these things, very nuanced discussions now that we're entering into with patients, not just as anaesthetists, but involving the whole perioperative team, intensivists, surgeons. So I think this is a good step, right?
Totally. And I think alongside that, one of the things that we've got to really focus in on is which are the outcomes that are important to patients.
Yeah.
Because we focus on the stuff that's easy to measure, death, within 30 days or while they're in hospital. Yes, of course, it's an important outcome, but there's so much more to it than that.
Yeah, true.
So again, as an anaesthetist, focusing in on some of our own outcomes, like the patient satisfaction, the patient experience, all that stuff, that's really important.
Yes.
But more broadly, what is it the patient wants to get out of the surgery? What is it they want to get out of the experience? And they don't just want to have the operation and recover from it. They want their life to either be extended or improved.
Exactly.
Or both, ideally.
Yeah.
And so what's our role in that?
Yeah.
How do we measure those outcomes? How do we, as anaesthetists, make sure that we respond to the data that we collect in order to improve those outcomes over time.
Yeah. And you're the perfect person to talk to about this because I know you've got a very big research portfolio. Could you give us perhaps some insights for those potentially people who are potentially starting out in research, some tips how you might navigate that space?
Thank you. So I suppose the first thing I would say is, and I really never thought that I would say this, I mean, research is such an interesting area to be in. It can feel really daunting. It can feel inaccessible to many trainees, I think. But it actually, if you've got an inquiring mind, which I think we all must have by virtue of the fact that we're here as health professionals, then you can do it. So that's the first thing.
Okay.
You need mentorship, so find someone that you can ally with that's going to give you some advice and help along the way. That's
a good tip.
And then start small and build from there.
Yeah.
Collect some data, think about what you can do with it, start small and build. And then the final thing, I guess, is collaboration is the absolute key.
That's true.
So the more that you can work with people, the better off you're likely to be.
Wow, there's some great tips there. So it's manageable, get a good mentor, start small and collaborate.
Yeah.
Fantastic. It's probably going to be similar, but I've noticed you have done, or you've held quite a number of leadership roles.
Yeah.
And again, you're a woman of colour, so am I. There's challenges with that, especially going into leadership roles in our slightly male-dominated specialty.
Yeah.
What have you got to say for the women coming through in leadership?
Yeah, it's a great question. So I think allyship is really important, and your allies don't have to be other women or other people that look like you. They can be anybody. Yes. I've had some fantastic male mentors and allies that 100%. Have really supported me. Yeah. So it's the right person, no matter what they look like or what their characteristics are. So that's and ideally the right people. And then I think the other thing is just put yourself out there. Don't be afraid to fail.
Yeah.
If you don't try, you've got no idea whether or not you would succeed.
Yeah.
So whether it's running for an election, for a college or an association role, whether it's applying for that job that might feel like a bit of a reach for you, give it a go.
Yeah.
I failed loads of times and I continue to do so.
Yeah.
And that's okay, because I think it perhaps proves that I'm trying to reach further.
Yeah.
And that's okay. It's okay to stumble.
Yeah, I like that.
But then just pick yourself up.
I heard a great algorithm. Is that what? Not algorithm. Whatever. When you have the first letter and it forms a word. I forgot the word. Escapes.
Acronym.
Thank you. Acronym. A good acronym for FAIL.
Okay.
First attempt in learning.
Nice.
We should all be failing because we should all be having first attempts. We should all be trying to learn and just extending ourselves. So that totally applies to what you just said.
I'm going to remember that.
And I'm going to remember the word acronym now, thanks to you. Look, thank you very much for your time today. Is there anything else that you would like to share with our podcast audience?
Oh, look, it's just such a joy to be here in Australia. I absolutely love your country, so thank you for the invitation. And I hope to be back.
Well, we love having you here. Thank you so much for making the long trek out from London. I know it's a very, very long way. So thank you for your time here and also for joining me on the podcast.
Thanks, Suzi. Take care.